Yes.
Now we move on to people with rare diseases, the India experience by Ms. Smitha Sadasivan. Smitha is a person with lived experience with disability due to a rare disease named multiple sclerosis. She has been an advocate for cross disability and inclusive health rights in India for the past 19 years. Recently, she spoke at the multi stakeholder meeting at the United Nations on the inclusion of persons with disabilities across the globe in universal health coverage and pandemic prevention, preparedness, and response. Smitha, over to you. You have 10 minutes, and how do you want me to alert you?
Yeah, thank you, Meenakshi. You can alert me at 8 minutes. And
Yeah,
I'll
sure,
be
sure.
ready.
You will. I know.
Sudha, so can you make it into a share screen mode? Yeah, thanks. Here we are trying to say the experience of India from all the rare disease groups. We have many patient advocacy groups on rare disease in India. Next slide, please. If you look at the data, there are globally 350 million people with rare diseases, and out of 70 to 96 million population, out of that is living in India, so which amounts to 5 to 6% of global population of persons with rare disease living in India. And sadly, 95% of the rare diseases in India don't have any approved treatment or supportive care essentials like special foods, etc. And there is a lot of inadequate facilities on screening, identification, and treatment of rare diseases in India. And there is a lack of trained doctors and paramedic services. And with regard to patient support, also patients are not getting, any even basic support, and many patients are suffering and mostly they are deprived of lifelong care services. And with regard to the advocacy, there is a lot intense advocacy happening from the patient advocacy groups, but that is not really adequate enough to move the government. And if you look at the main issue for all these issues, it is we don't have a proper definition of rare disease in the rare disease policy, and we don't have a policy on orphan drugs in India. Next slide, please. When we look at the interventions by the government of India, yes, our government have done something for rare diseases, and it is a welcome approach. Definitely, we have a national rare disease policy by the government of India, and the government of India is also providing 5 million rupees for the treatment of persons with rare diseases based on the policy, whereas that is not adequate for continuing treatment through years for any person with rare disease. That is the issue. And also the disbursement of this fund is needs to be streamlined. And our government is also doing the production linked incentive. It has announced 15,000 crore rupees, and this serves as a corpus for any institution that is wanting to take up research in rare disease, which is a very welcome step. And recently for sickle cell anemia, our government have budgeted 500 crores, and now a committee has been set up under the government of India to work on the treatment protocols of sickle cell anemia. And government of India have also arrived at specific funding for research and development in biotechnology. And ICMR has come up with a task force on gene therapy for rare disease, and has also initiated a virtual center for molecular medicine. And ICMR has also formed a national consortium on research and development of therapeutics for rare disease, where multi stakeholders are part of it, and civil society is trying to get into it. And the other thing is the Department of Biotechnology is also working on genome India and human microbiome initiatives. Next slide, please. Suja? Yeah, so whereas when we look at the interventions of the civil society, it is a huge contribution from the patient advocacy groups. We have Dystrophy Annihilation Research Trust based in Bangalore, and where the muscular dystrophy groups have come together and working on research. And Tata Institute for Genetics and Society is also doing a great deal of research on mRNA towards therapeutic drug development for rare disease, and they have signed an MOU with the World Without GNE Myopathy group. And Tuberous Sclerosis Complex Alliance India is also studying on the natural history and the background, the causes of the disease. And many patient advocacy groups are working towards research and therapy, like limb girdle muscular dystrophy group is working on developmental therapy in collaboration with Jain Foundation. And Ashoka University is working on a Myome mission, and it is an integrated approach of 24 research institutes across the country with 55 researchers, and where the civil society, the patient advocacy groups are really contributing. And apart from that, the civil society and the patient advocacy groups are collaborating with the government, like the Department of Science and Technology have opened up proposals for coming up with therapeutic strategies for the prevalent rare diseases. And also the Department of Biotechnology is working on mission program on pediatric rare genetic disorders, where a lot of proposals are being worked out from the patient advocacy groups, and the civil society is really working hard in all these collaborations and also with their expertise. Next slide, please. And as the advocacy continues, it is from the newborn screening and throughout the life cycle, we are advocating for our individual patient groups and as well as an umbrella network for all rare diseases. So we are advocating towards the newborn screening across the country, and also we want a nationwide registry. We are focusing on that, and through the successful advocacy of rare disease groups, 11 centers of excellence have been announced by the government of India. And apart from that, at the next level, the Nidan Kendras are also announced, and the civil society is trying to get Nidan Kendras in at least every state capital. And the next category is in every district hospital we need a rare disease clinic. So we are working towards this, and civil society is also working towards getting an orphan drug act enacted by the government of India and getting the CSR funds towards research and development, and to clear-cut definition for rare disease and the disbursement of the 5 million rupees at the district government hospital, so that people can get it get their treatment at the district level. And a lot of coordinated referrals and support initiatives for patients are being provided by the civil society. And civil society is also working on intellectual patent rights protection with the drugs and therapies imported from abroad, and also developing the indigenous therapies. And through the successful advocacy, now there is the turnaround time in diagnosis has improved, and it has come down. And also when we identify a person with rare disease, the members are onboarded to join the All India community and are part of the mutual support groups. And apart from treatment and therapy, it is also the holistic approach of education and their livelihood, professions, and their holistic development is looked at by the civil society. Okay. So a lot of sensitization is being carried out by the civil society, especially with the decision makers and the health professionals, and a lot of community engagement happens around the mental and emotional well-being also, starting from knowledge sharing and looking at rehabilitation aspects like respiratory care, orthosis, and other disease modifying treatments, and management of specific rare diseases is looked at by all the patient advocacy groups. For example, the muscle and joint and central nervous system bleed management is looked at by Hemophilia Federation, and the fatigue management is being worked out by Multiple Sclerosis Society of India, and so on. Every patient advocacy group is doing that, and apart from that, a lot of awareness initiatives is being worked out. Like Cure SMA Foundation is doing a lot of sensitization on storytelling, and also the Indian Rett Syndrome Foundation conducting a lot of symposiums, and Organization for Rare Disease India coming up with a lot of awareness run and care for rare, etc. And the Foundation for Rare Disease is again a multi-stakeholder umbrella network, having a specific dashboard of specific stakeholders, and also like having referrals and supporting patients like any other network. Next. So we can see a few photographs here on rare disease awareness initiatives. Sujat, can you go to the next slide?
Yes, Smitha, I'm in the case study now.
Oh, okay. Just picking up a couple of case studies. I don't see that here. With Anvesha, an organization working in West Bengal, at the community level, and they have identified a person, a young man with Meniere disease, and he was, from birth till 15 years, the diagnosis was not happening, and the family struggled, and at 12 years he went on bedridden, and even he had hearing loss from the birth, and so they had to move from different states, and finally when they could diagnose, they could get the appropriate diagnosis and the appropriate treatment. The family could not, afford it, but Anvesha stood with them, held with them throughout their journey, and now that young man has a diploma in art and culture, and is a professional artist now, and is also supporting Anvesha in their initiatives. And finally, we have the case study from Vidyasagar, Chennai, whose community-based program identified 3 siblings with Usher syndrome, and they not only helped with appropriate medication and treatment, whereas they also, Sujan, next slide please. Also supported them in education, both in school and at the home-based environment. And apart from that, they also figured out that there is a lack of livelihood with the family, and they supported the dad of the 3 siblings by setting up a food cart business, and now the family is getting a steady income out of that setting. So these are a couple of examples and case studies how our civil society groups, our patient advocacy groups are working holistically with patients with rare diseases. And yes, along with the collaboration with the government, we are having hope that we will have a very good appropriate policy with a good definition, and appropriate and proactive and rights-based services, health services for all persons, adults and children with rare diseases. Thank you very much.
Thanks, Smitha. The key takeaway message has been data, building data and registry, so that it links with the policies, programs, and the social protection measures of the government, the budget, implementation, and having a good institutional mechanism for effective utilization of the budget, which is already allocated, and to know the resources that is required for better services. Then community-based approach that looks at a life cycle approach, and participation of persons with disabilities across domains.